This is a video on validity of assessment, and I am Dr. Swapnil Parlekar. I'm a FIMA fellow from CMC Ludhiana and an associate professor in physiology at Medical College. Meet Dr. Meera in her class. She is a very dedicated physiology teacher, and she wonders whether her assessments are truly measuring what she thinks they should measure. And this is a question on validity. The thermometer measures the temperature. That is, it gives a number. But is it measuring the true temperature? That means, is it really valid? Meera observes that one student scores well in the exams, but he is not so good in managing patients. And another student scores low in the exams, but is quite good at managing patients. So she concludes that marks is not equal to competence, which leads us to the illusion of score. Consider a bullseye. Now, one arrow hits the bullseye, that is the target. That means it is a valid assessment, while another arrow clusters around the bullseye, not hitting the target. Is it a valid assessment? Certainly not. The first one is. In medical education, we measure knowledge, attitude, and skills, and these together constitute clinical competence. So, what we are measuring is knowledge, skills, and attitude. And in medical education, we measure abstract concepts called constructs like professionalism, critical thinking, clinical competence, and so on. What is a construct? Look at this beautiful model. Beauty is a construct. Why is it so? Someone cannot be beautiful in one situation and not be beautiful in another situation. So, construct is an umbrella term for a latent characteristic of interest like honesty, beauty, and courage. And it is a product of scientific imagination, and which can be operationalized through a measurement process. So now we move to construct validity. So if clinical competence is a construct, then it has these components, that is knowledge, skills, and attitude. And they define the clinical competence, which is a construct. Threats to validity are of two types. One is construct underrepresentation, that is, the construct is underrepresented, or construct irrelevance variance. Underrepresentation means a professor asking his favorite questions repeatedly in successive exams. So the construct is underrepresented, or an irrelevant factors like lack of an AC, students' proficiency of English influencing marks makes it irrelevant. Validity is not a property of the test. It is the inference which we derive from the results for a particular problem. And multiple assessments by multiple assessors in multiple settings help in building validity. Thank you. And I'm Dr. Swapnil.